Dr. Greg with Align Wellness Center, and I just wanted to share with you and go through and do a bit of an adjustment with one of our patients. Now I want to introduce you to Austin. Austin has been a great patient of ours for years. He actually got introduced to the practice from his wife was a patient. Now Austin spends some of his time here in Chicago with us, as well as some of his time out in California. And this summer, early in the summer, what happened?
I was playing tennis and I made a move and all of a sudden my back went out.
Oh wow, okay. And how often do you play tennis?
At least twice a week.
At least twice a week. And how old are you?
81.
81. So an 81-year-old tennis player twice a week. That's pretty awesome. Awesome. You must be doing something special. So you reached for a volley and you felt your lower back bother you.
Yes.
We got together. We found some really interesting and unique things about Austin's spine. He's got some segments that are fused and don't move. And well, we're not going to do anything to wind up making them move, but we've got to make sure that the other areas move to support him the way that they should. So we've been using some really unique adjustments to wind up helping him work his best to stay on the court. And what did you tell me about your game just the other day?
My game is back to pretty close to normal. I can serve well again and I'm moving well.
That was the big one. You were able to serve, and that's an overhand serve for those of you out there. An 81-year-old doing an overhand serve. Let's go ahead and get into the adjustment, and then we'll see what's going on. Go ahead and lay down on your back for me, Austin. I'm going to grab your feet and pull on them. Okay. Now I'm going to feel your head and your neck. Now for Austin, I know that a lot of you out there are going to look for loud noise pops and sounds and a big adjustment, but in his case with his spine, the way that it's changed right now, we're not able to do that. We probably won't. So we look to use some different adjustments, for example, a sustained hold in a corrective position to help bring his head back up over his shoulders. We'll also wind up doing some extension of his head to wind up helping to just reduce some tension on some of the muscles in his upper back, because most of Austin's neck is fused in the position that it's in. I'm going to check his legs again just to see how they changed, and I really like that. We're going to check his hips and his pelvis. Don't let me move you. Don't let me move you. Bring your leg out. Keep that there. Keep that there. Good. We're going to bring your leg up straight. Hold that. Turn your foot out. Good. Straight up with this leg. Keep that there. Turn your foot out. Keep that there. All right. Austin, can you lay on your stomach? Sure. So Austin knows to use a great form we recommend. I'm typically looking to roll over that way. And we're going to feel the rest of his spine. So we're going to feel his hips and his pelvis. Okay. We'll do a positional adjustment to help his spine move better. Okay. I'm going to have you take a deep breath in, Austin, and all the way out. Good. I'm going to lift your head up, and we're going to lift the other side. All right. Austin, did you feel that?
Yeah.
Great. Okay, we're going to push on your pelvis as well. All right, so the table's going to go up and down right here. It's going to go down. Bend your knees, let your knees go. Okay. So we're going to finish by putting him in what we call a mirror image position. For him, we're going to lift up his hips. We're going to let his torso and his lumbar spine just drop. You might notice it doesn't drop very far, but we're going to look to elevate his head as much as we can. And let him just hang out here in the in-between. Now for Austin, due to the rigidity of his spine, the fixations, the arthritis that's developed, we're going to just look to rock him in this position. We'll also look to fire off a lot of the joint receptors. Those are the nerves in your spine. Now, those nerves, remember when you were a kid and you got a boo-boo? And mom used to wind up rubbing on the boo-boo and it felt better? Those receptors are really the main trigger points for that. So when you wind up getting a boo-boo, if you rub on it, like you do for your little kids, I do it for my kids, Logan and Jordan at home, it winds up overriding the pain pathway and it'll feel great. Another way to override that, if you don't have mom around to rub on your boo-boo, is to actually do some steps, or if you can't walk because it's so tender, you're so tender or painful, just lifting and lowering your feet will wind up firing off a lot of those. So I want to use that technique to try and help in managing some pain if you're having difficulty. Now I'm going to grab one of our tools that we use to help with our adjustment. So we're going to look to adjust in certain areas that have a lot of them. All right, we're gonna lower the table down. Austin. Okay, and then Austin, let's see an awesome dismount.
Okay, I'm gonna give it my best shot.
Yep, so we're gonna roll to your side, either side, bend your knees forward, and then walk your way up the table. Fantastic. Austin, how was that adjustment?
Excellent.
How you feeling?
Very good.
Super. What would you tell to anyone who's looking to try to stay on the tennis court at least twice a week until their 80s?
Just keep practicing and work hard, and if you need it, come to see your chiropractor.
Awesome. I want to thank you, Austin. Is it all right for us to share this with anyone everywhere?
Absolutely.
All right. If you're wondering if chiropractic may be right for you, or if you want to see if you can do some things to help you stay on the tennis court until you're 81, or better yet, until you're 61 or till you're 21, let's look to connect and figure out what your limitations may be so you can stay as active as you want to for as long as you want to. Once again, I'm Dr. Greg Gerstin with Align Wellness Center, and I'm excited to be a part of your health.
Thank you.